So before assessing my patient in the clinic, I would go into the room, introduce myself, do hand hygiene, and ask them for their name and date of birth. For privacy purposes, I won't ask her for her name and date of birth for this video. Also in the clinic, I'd have my patient completely undressed and have a gown on so I can accurately hear what I need to hear and I can accurately assess them. For modesty purposes, I'll have her stay completely clothed and I'll do my assessment over her shirt. This is a grade for one of my classes. My professor will be watching it. Is that okay with you? Yes. Perfect. Okay, my name's Kelsey. I'm going to be a nurse practitioner today. I'm going to start off by measuring your JVP. If you want to lay down, 30-degree angle. So we're going to be measuring your jugular venous pressure. It's best to do it on the right. And just turn your head to the left. You want to find the right internal jugular vein. Stops about right there. Measuring at the sternal angle, it's about 2 centimeters. Good. Okay, you can go ahead and sit back. Next, I'm going to auscultate your carotid arteries, listening for worries or turbulent blood flow. So take a big deep breath in, then completely exhale and hold your breath. Good. Take a big deep breath in, exhale. Good. Next, I'm going to do my cardiac assessment. I'm going to start at the second intercostal space. Listening for the aortic valve. Second intercostal space. Pulmonic valve. Third space, Erb's point. Fourth space, tricuspid. And fifth space, mitral. And I'll go back there with the bell. Second intercostal space. Aortic valve. Pulmonic valve, Erb's point, tricuspid, and mitral. And you would really want them to be completely laying down, and for women you'd want to just place the breast so that you can really get a good sound and be able to listen the best. Next I'm going to listen for mitral stenosis. Have you lay on the left side. Left lateral decubitus position. Legs bent a little bit. And you want to listen at the apex. Listening for any mitral stenosis, and you can go ahead and sit back down. You want to listen for aortic regurgitation. You'll sit down, lean forward, take a big deep breath in, completely exhale, and hold it for me. And listen for any aortic regurgitation. Okay, good. And you'll lay back down for me. I'll listen to your abdomen. Starting in the right lower quadrant, right upper quadrant, left upper, left lower. So you just have normal active bowel sounds if you're clicking throughout. And you can also listen over the aorta for any turbulent blood flow, the renal arteries, iliac arteries. And then femoral arteries. Next, I'm going to percuss. You want to hear tympanic sounds throughout. Good. She's tympanic throughout. Next, I'm going to do light palpation. Any tenderness?
No.
Tenderness, no. And then you want to do deep palpation, assessing for any masses. Does that hurt?
No.
Also, when you're auscultating over the abdomen, you can also auscultate over the liver and the spleen, listening for friction rub as well. Okay. Next, I'm going to go ahead and assess for Murphy's sign. So I'll put my thumb underneath the costal margin. You'll take a big deep breath in. Any pain? Good.
No.
Do it. Big deep breath. Any pain?
No.
Okay. I'm going to do Rovsing sign, which is when you palpate the left lower quadrant. I'm going to press and then release really fast. Okay. Any pain? Good. Next, I'm going to do the psoas sign. So I'm going to hold some pressure against your leg as you lift your leg up. Okay. Go ahead. Good. Any pain?
No.
And that's checking for appendicitis. And then you'll turn on your left. Okay, and this is also checking for appendicitis. Rovsing sign is appendicitis, and then Murphy sign is looking at your gallbladder, just to recap. So you're going to go ahead and flex your hip and extend your knee. Flex your knee. And then internally rotate. Any pain?
No.
No? Good. Okay, and you can flip back over on your back. And then looking at McBurney's point, you want to find this belly button, umbilicus, and then go 2 inches above the anterior superior iliac spinous process. And then I'll palpate here. Any pain?
No.
Good. Okay. We're done. I'm going to percuss the liver. So starting at the bottom, we're going to go up, percuss. Should be tympanic throughout until you get to the liver, and then it should be dull. And then you're going to go from the top mid clavicular line down and percuss down to the liver. Should be resonant, and then you meet dullness. Okay, we're done. So there are 6 types of murmurs. Grade 1 murmur is very faint. It's only heard when the examiner is tuned in to their exam. They're very focused, and then they can hear that murmur. It's also not heard in every position on the chest. Grade 2 is quiet. It is heard when you place a stethoscope on the chest in all positions. Grade 3 is moderately loud. Grade 4 is loud with palpable thrill. Grade 5 is very loud with a thrill that may be heard when the stethoscope is partially off the chest. And then grade 6 is very loud with a thrill that is heard when the stethoscope is off the chest completely.